My name is Justin Annis. I'm at Stanford University, where I'm an associate professor. I have been working on a project funded by the NETRF that focuses on targeted chemotherapeutic delivery to neuroendocrine tumors. I came into the field as a beta cell biologist, actually. During my postdoc, I was really focused on regenerative medicine and trying to find ways to drive beta cell regeneration and proliferation. And historically, I'd been interested in cancer and cancer therapy, but then found myself in this area. And then over time, my interest kind of evolved into really understanding not how to drive beta cell replication or insulinomas, but how are these tumors forming and what can we do to treat them? And it just kind of melded with my other interests in hereditary endocrine tumors. And so that kind of came together in a way that I launched a research program in this area. I think something that is easy to understand is that we have lots of chemicals that we can use to kill cells, right? So if you take something out of the body, we can treat it with a medicine or a drug and we can get rid of it. One of the problems, or a major problem, is we can't do that in people to eradicate the tumors. And one of the primary barriers is all the normal cells. So how do you selectively eliminate tumor cells without causing side effects that are intolerable? Right? Because many of the doses that work, you just can't do in people. So the focus of my project has been to make what we call smart medicines. So the medicines go into the body, they go everywhere, but they're only active or activated by the tumors themselves. So they take advantage of unique properties of the tumor so that the drug is active there and only works there. My research is really driven at solving a problem rather than understanding a mechanistic question of how tumors form. And that is really almost like an engineering problem. We want to make drugs that work but don't have side effects. And we start all the way at the beginning, which is making the medicines and then testing them in the cell culture and then testing them in mice. At this phase, we've done a lot of proof of concept in the animals, and now we're trying to figure out how do we make our drug better and safe enough that we can make this jump to clinical trials. This research that we're doing really started as a concept, as an idea. And there's very few places you can turn to get ideas paid for in the research field. And so NETRF stepped up very early on as a pilot project and gave us the funding to initiate this work. And it's been really critical to go from concept to now in partnership with a company that's trying to help us to get this into the clinic. When we're in the lab, there's lots of great ideas. And taking those ideas into reality, that transition is one of the hardest steps. And you need people who are willing to put chips in behind you and to make a bet that you are committed to this disease and that you want to make a difference. And I thank the NETRF donors for being those people who are willing to say, yes, we trust these investigators and we want to see them make a difference for this disease. So thank you.